Hi, I'm Mary Ellen O'Donoghue, Director of MS&L's Healthcare Practice in North America, and I'm joined by my colleague again today, Kelly Danker, who runs the healthcare practice in New York. Thanks again for joining us on day 2 of the FDA's hearings on social media guidance. And we heard a lot of great themes discussed yesterday, Kelly. Anything in particular jump out in today's discussion on day 2?
There actually were a lot of similar themes to the first day about adverse event reporting, the rules and guidelines around listening for pharma companies in the space, but it's a really complicated and very dicey issue, especially when you think about the fact that much of what's happening on the web is anonymous. And so for somebody to post an adverse event or suggested adverse event becomes
Sure.
really problematic for the companies because there's no way to really track them down.
Sure.
Notably, when you think about the 4 criteria for reporting an adverse event, is there an identifiable patient? Is there an identifiable reporter? Is there a specific drug or a biologic that's involved? And importantly, what was the adverse event or was there death that was caused? So trying to track that down is extremely challenging. But on the flip side, there's a lot of support for pharma companies being able to listen in on this space.
Well, yesterday it was really interesting because I love the fact that many different companies and organizations were raising issues, but they were also offering solutions. So
Right.
Again, in the area of adverse events reporting, let's recap some of maybe the suggestions that were made today in front of the FDA.
Sure. I think one of the most important points is that the social media, the web, is such a great place to get information about adverse events. So while it may be tricky about trying to track the people down that maybe have an adverse event, what is really important is that there's so much sharing of information. So one of the big takeaways was focusing not about the who or the how related to adverse events, but rather what are the technologies that are in place that allow us to focus on getting people to the right place to deliver the adverse event information.
Yeah.
So for example, there was a discussion about widgets today, putting widgets on sponsored sites that will take them to an FDA location to complete the information about an adverse event.
Right.
About MedWatch, putting up an 800 number, a link on sponsored sites that will take them to the right place to
Yeah.
report an adverse event. There's a lot talked about the simplification of the reporting. How can the forms be simpler? How can they be in more consumer language that they understand and not be daunting so that people don't go through the trouble of filling it out because it's very useful information.
Sure.
And finally, about changing the name of MedWatch. It doesn't necessarily explain what it means, and is there a simpler way to be able to communicate to consumers and what it means and what it does so they know to click on it.
I think finally, one of the other things that was discussed today, which I thought was interesting, was the whole concept of listening. So, how are you listening as a company, and maybe things are bubbling up in terms of
Right.
a possible reporting issue, and what do you do with that? What do you do if somebody
Exactly.
hasn't reported, but what do you do in terms of the listening factor? What do you do with that information or respond before something actually becomes an issue? So I thought that was very interesting as well.
And it was actually a big point, in fact, in that many companies are afraid to monitor and listen because they're afraid they're going to see an adverse event and they're not sure what to do with it because there's no guidelines around
Sure.
it. But many people that came to the podium today spoke about the importance of pharma listening because they felt it was very important that they hear what's being said about the products and that they are hopefully being able to alert the FDA or consumers if there's a trend or a trend in the consistency of an adverse event showing up that they should be looking into more deeply.
Right. And so I think, all of us are kind of looking for the guidance that is expected to come out next year. Obviously, the comments, anybody can comment through February. In the meantime, that's a summary of the FDA's social media guidance hearings. Please join our webinar, which is Tuesday at 3 p.m., where our Director of Word of Mouth Marketing will join us, Dave Binkowski, Scott Gottlieb, MD, former Deputy Commissioner of the FDA, myself. And if you'd like to get information to join our webinar, just go to twitter.com/MSL Worldwide. Thanks for joining us.
Thank you.